Should you take vitamin D and calcium together?
Why not?
No, we're starting. All right, let's start.
Okay.
Okay. Should you take vitamin D and calcium together?
It is a standard procedure in supplementation that they are included together in most supplements.
So you're saying that if your calcium supplement doesn't have vitamin D in the blend, it's probably not a good one?
Well, not necessarily. See, these nutrients stay in the body for some period of time.
Okay.
So as long as you're getting them in the same proximity, it's fine. The concept behind putting vitamin D with calcium in the same supplement was the assumption that most people are vitamin D deficient, which in fact is true.
Okay.
And so by adding it into the calcium supplement, that potential problem is eliminated.
Oh, okay. And so how do people know if they're deficient in vitamin D or calcium?
Well, there's the standard blood workup.
Okay.
And there's also symptomology. And that means that every nutrient has connected to it symptoms of its deficiency.
Yeah.
So we can evaluate the degree and number of those deficiency symptoms by extensive questionnaires.
So are there risks of taking too much vitamin D?
Well, there are risks of overdosing on anything.
Yeah, like we've talked about, yeah.
Too much of a good thing is not necessarily wonderful.
Yeah, like we talked about the frat people drinking water and
Yes.
ODing on water and dying.
Yes,
Because
it just happened again.
Yeah.
It was just in the news again. Somebody almost died from ODing on water.
Yeah.
Diluting electrolytes isn't always a good idea.
No.
But anyway, back to vitamin D. Vitamin D is a fat-soluble nutrient. Therefore, it stores in the body in the liver.
Oh, okay.
So it can build up to excessively high amounts. It's difficult, but it's possible.
Okay. And is vitamin A also dangerous in too little or too much amounts?
Well, vitamin A is probably one of the most important nutrients that we have.
And misunderstood.
And very misunderstood.
Yeah.
Somehow this propaganda got out there that vitamin A, it's toxic.
Yeah.
Well, the reason for that was it's based on a very old study in the early 70s where somebody decided to keep track of how much vitamin A toxicity patients occurred. And there were 11 in this particular year that were hospitalized. But the problem was what they didn't reveal publicly was that all 11 people were under a doctor's care at the time, and they were all given high doses of synthetic artificial vitamin A, which the body cannot metabolize. If you take natural vitamin A, there is far less issue with toxicity. But again, too much of a good thing is not always wonderful.
Yeah. And so are in your opinion, do you think vitamins and supplements are necessary or are they a scam?
Oh, in this day and age, they're absolutely necessary. Our food has so been degraded nutritionally.
Yeah.
Starts in the farm with the soil, goes through harvesting prematurely, goes through cold storage, goes through overprocessing. Do you know that 40% of children, and I think that's low,
Yeah,
but
I
they're
think
saying
that's low.
40% of children subsist almost exclusively over an ultra-processed food diet.
Yeah. And there's no nutrients in there at all. I mean, it's
virtually none.
Yeah.
Yeah.
And so what is megavitamin therapy and how does it work?
Well, the government has established, and that should be a slight warning already, the government has established what they call daily value.
Yeah.
That's the amount of a nutrient that you need for wellness. Keep you out of the hospital, keep you out of bed. That doesn't necessarily mean it's an optimal dose for everyone. Now, when we get into the mega range, which means excessively high, we do that if there is a patent gross deficiency or there's a health challenge that needs to be addressed more aggressively.
Or even maybe if you've neglected yourself for a really long time.
Well, yes. Sometimes we have to bring people back rather quickly.
Yeah.
Let's say in the case of arthritic inflammation. Well, every day that goes by, more damage is taking place.
Yeah.
So the faster we can get that inflammation under control, get the joints lubricated, get the body stimulated to rebuild cartilage tissue, the better off it will be.
And I guess, would that be called front loading too?
Yes.
Front loading, yeah.
Yes. For example, if a person presents with any sort of issue that we know nutrients can be a benefit to, we usually recommend a therapeutic dose for the first 3 months minimum.
Yeah.
And then we reduce it to what is called the maintenance dose and see how the individual responds. And that's a concept of front loading, where we're going to saturate the cells of the body with this nutrient. And the point of the matter is that it's incredibly safe, because most of these nutrients the body recognizes, and in so doing it knows what to do with them.
Yeah.
If there's too much, it knows how to get rid of them.
Yeah. What's your opinion on gummy supplements, and are they safe?
Well, they're a little chewy, and they're full of sugar. But other than that, I suppose the delivery system is better than nothing at all.
Yeah, but let's be honest. I mean, really, from what I know, and I'm not a scientist, but from what I know, you can't really fit that much nutrients in those. Is that really the problem?
Well, that's a huge problem.
Yeah.
If they, first of all, they rarely contain the full spectrum of nutrients. Secondly, they usually contain the daily value only of a handful.
Yeah.
Because that's all that goes in amongst the pectins. So
yeah. And so what questions, if somebody's never taken a supplement that's a real supplement, like high vitality liquid from Phoenix Nutritionals or high vitality capsules, that's a real vitamin that has 100+ nutrients, not like some one a day or some Centrum that has 6 to 8 and they're saying, yeah, this is great, you're going to walk on water after this. What questions should people ask before taking something like a high vitality liquid or a real vitamin?
Well, the first question they should ask is, do I need it? And the answer to that almost universally is yes, because of our degradation of our food supply.
Yeah.
And then we go back to age. There's the age of invincibility.
Yeah. Well, when you're young, yeah.
Yeah. And so I don't need that. I'm fine. And then when they're 50, this hurts and that breaks down. But they were fine before.
Yeah.
So now there's another way, which we have developed at our research center. If a person really wants to get an in-depth evaluation based on symptoms, we have a fantastic, very extensive symptomology evaluation that pinpoints all the nutrients, all the vitamins, herbs, minerals, etc. It even addresses evaluating levels of stress in your life, which indirectly and directly relate to inflammation, which is a huge problem.
And then that kind of gives you the answer.
And that gives us a very clear picture of what's going on biochemically in a person's body. And that evaluation is available through us. If anyone watching this might be interested, just put a little comment down below.
Yeah, it's at healthyinformation.com.
Yeah, and let us know, and we'll be in touch.
And how do you get enough vitamin B12 for people who have diets that don't allow them to do that? Let's say like maybe a vegetarian or something.
Vitamin B12 has two problems. Well, two obstacles, not problems. First and foremost is it's very hard to be absorbed anyway.
Okay.
It's one of the most difficult nutrients for absorption. Secondly, it's generally only available in animal products
Yeah.
and animal protein. So if someone is a strict vegan, they have to be very careful about gross vitamin B12 deficiency. So the simplest way to solve that problem is just simply take a B12 supplement.
And let's be realistic though, not just vegetarians, but most people aren't consuming enough animal protein either because of time, of cost.
Cost, I know. For example, right now, meat has gone through the roof.
Yeah. And so realistically, not just vegans, but probably the majority of people are vitamin B12 deficient.
The majority of people are vitamin deficient. And you see, when we talk about B12, this is a classic example. When you take B12 by itself, the absorption rate is going to be far less than if you take it together with the other B complex.
Okay.
Because they work together in concert. And keep in mind that vitamin B6 is the carrier nutrient, and it is necessary to transport and facilitate the absorption of other nutrients. So taking B12 by itself in the absence of other nutrients, which is highly likely with our dietary indiscretions, further reduces the potential for absorption.
And so let's take a complete right turn here. What is the best time to take biotin? And what is biotin?
Biotin is one of the B complex nutrients.
Okay.
As such, it's water soluble. For the most part, with few exceptions, all supplements, all nutrients should be taken with food. So at a meal. Because when the stomach has food in it, it begins to change chemically through the secretion of gastric acid. And that facilitates the absorption, digestion, and breakdown of your food. Well, if your nutrients are there at the same time, they just go along for the ride. And so, with very little exception, supplements should not be taken on an empty stomach. There are some exceptions.
Including biotin.
Including biotin.
Can a good multivitamin truly benefit healthy people?
Yes.
Okay.
Like keeping them healthy.
Yeah.
I've often said that
Common sense.
that a good full spectrum supplement is true health insurance.
Yeah.
Those health insurance cards you get from work, that you sit on, and they're disease insurance cards.
Yeah.
Because you can only use those when you're sick. A good full spectrum supplement is true health insurance because it's going to help keep your body healthy by keeping your internal biochemistry balanced.
Yeah. And what causes bloating and what helps with bloating as far as nutrition?
Well,
if somebody really wants to do it, of course, if somebody wants the short answer, yeah, go grab some Tums and do it that way. But if somebody really cares about the future and who's trying to really do the right thing, what can people do for bloating nutritionally to maybe stop it sooner and to continue to fend it off?
Well, most bloating occurs in the stomach.
Yeah.
You get that feeling like you've swallowed a melon without cutting it up. You've got this huge belly and it starts regurgitating up your throat. That is a symptom of a lack of stomach acid. Mm-hmm. And so the best thing to do, the biochemical thing to do, is to increase stomach acid.
Yeah.
And we can do that in two ways. We can do that with a good digestive enzyme that provides all the whole and enzyme precursors. It's highly acidic, and that will more and faster than anything I can think of solve this problem. If you eat a meal that is going to bloat you, if you take 2 or 3 good digestive enzymes, you'll find that bloating probably will never happen.
Yeah, because you're naturally increasing stomach acid.
Yes.
Which would combat the bloating.
Yes. Which, of course, is opposite of taking antacids. But that may be for another discussion.
Yeah. What supplements give you more energy and reduce fatigue?
Well,
this was a question asked by a lot of our vegan people.
Well, the classic group of nutrients for energy are the B complex vitamins.
Yeah.
Which is something that...
Not just B12.
No, yeah. All of them. Because the reason
they work in a concert.
We call them the B complex nutrients because they all have something in common. And therefore they need to be taken together at the same basic time. But energy-wise, vitamin D, vitamin E, the B complex, calcium, selenium, these are all zinc, iron.
Yeah, zinc. Yeah.
These are all nutrients that affect the energy cycle of the body.
And what is the best probiotic or supplement for digestion and gut health?
Well, probiotics work in the small intestine and the colon.
Yeah.
And the best one that you can pick is one that is from multi-strains.
Okay.
In other words, not just a single bacteria.
Yeah.
But ones that contain 3, 5, 7 or more strains of bacteria, because they're going to have a more profound effect and have a more rapid effect on the intestinal lining.
Yeah. Well, I've known people who claim that Phoenix Nutritionals, the best probiotic from Phoenix Nutritionals, have changed their life. And I'm always so interested. I'm like, well, what did you do?
Well, it's because we've got 7 strains of bacteria in there. Yeah. And it's in a very easy to digest and break down delivery system.
Yeah.
In a micro thin vegetable capsule.
And more often than not, they admit that they were not following the best diet before.
Well, sure.
Yeah.
Yeah. There's 2 kinds of people in the world. Kind of people who say, I don't eat very well and I don't eat very healthy most of the time, and the kind of people who lie and say they are.
Yeah. What's good for joint pain and inflammation?
Well,
nutrient wise.
First of all, for inflammation, we have curcumin, which comes from turmeric.
Yeah.
We have boswellia. We have methyl sulfonylmethane, MSM. And those can be very powerful natural anti-inflammatories. And we have used those in going back to megadose amounts that we talked about earlier. And we were able to get people off of over-the-counter anti-inflammatories such as NSAIDs.
Yeah.
Or at least, at the very least, greatly reduce person's dependency on those.
Yeah.
Which in the long run is a good thing because they have some potential side effects when you use them constantly.
Yeah. And so the last one is, can supplements and nutrients actually help with weight loss?
Oh boy, yes indeed.
Yeah, well, I know that.
Yeah.
Because whenever you help me lose 60 pounds, I was taking the blood sugar support to help balance everything.
Yep. Keep in mind, and I wrote this little book called The Weight Management Revolution, and it is available as an ebook download on Amazon.
Yeah.
And I believe it's...
If you have the Kindle thing, it's free, yeah.
Yeah, and I believe it's still, the link is still on healthyinformation.com.
Yeah,
you can download that thing right from there. One of the top 10 reasons that we discovered in our research for weight loss failure were nutrient deficiency.
Yeah.
When the body is deficient in nutrients, it perceives itself as starvation. And when the body's in the starvation mode, its metabolism reduces to near hibernation.
Hibernation.
Well, that doesn't
And that holds weight.
that doesn't sound like a recipe for effective weight loss, indeed.
Yeah. Well, hey, there you go. If you have any questions, for our next video, if you have any questions, just leave a comment. Don't forget to like, subscribe, comment, and 619-871-1855.